Hi everyone, I am Bud Fassnacht with Creekstone Benefits, and I would like to start by thanking TrueCore Federal Credit Union for allowing me to present an educational Medicare 101. Due to some Medicare regulations, I can't answer any plan-specific benefits during this. If you have questions, I can do that later, and I will give you some contact information towards the end of the presentation. So again, thank you. I'm going to start with page 1 of the handout. It's the 4 original parts of Medicare. So the first one is Part A, which is generally called hospital coverage. So this is where your inpatient stay, skilled nursing, and hospice care benefits fall under. Everybody gets Part A when they turn 65. Usually premium free because either you or your spouse or a combination thereof have been paying into Medicare through your employer over the years. That part is pretty seamless. The next part of Medicare is Part B, as in boy. This is what they call medical coverage. This is where your doctors, specialists, outpatient procedures including surgeries, any diagnostic testing like MRIs, PET scans, labs, and x-rays all fall under the Part B of Medicare. So generally these two parts of A and B cover 80% of your claims. You're responsible for the remaining generally 20% of your claims, but there's no cap on how high that 20% can cost you. So this is why people start looking at either a Medicare supplement plan or a Medicare Advantage plan. I'm also going to tell you when you first start looking at those other options, you do have to work with the Social Security office to make sure you have both A and B in place. That's what you might see on your red, white, and blue Medicare card. Because in the tons and tons of mail you were receiving, most of it's going to be advertisement, the Social Security office will send you an envelope. It will kind of look like junk mail. It doesn't stand out for security purposes. So open your mail. Like I said, 99% of it's going to be advertisement. But this one's important because the Part B of Medicare, the federal government charges a monthly premium. For 2021, the monthly premium is $148.50. Next year, starting in January, the monthly premium is going to go up to $158.50. They collect that money one of two ways. If you're drawing Social Security benefits already, excuse me, they will take that directly out of your Social Security check before it even gets deposited into your account. If you're delaying Social Security, they will bill you quarterly for that amount. The bad news is that premium that they charge does not go away even if you sign up for a plan. So just keep that in mind. Part C of Medicare, these are Advantage plans. These are the ones we are seeing the commercials for all the time. Things to know about Advantage plans. So your claims for services are going to be paid by an insurance company. So your benefits will be with an insurance company. When you're talking to an agent, you need to let them know what doctors, hospitals, and prescriptions you're taking because these plans are set up for co-pays. So there will be a co-pay for every service that you have done. It's like going to see your primary care doctor could be $5. Seeing your specialist could be $35. Every one of these plans has what they call an out-of-pocket maximum. So that is a limit on how much in medical claims you'll pay in that benefit period. Benefit periods for Medicare are calendar year. So everything's January 1 through December 31st. So when you're looking at those types of plans, just share that information because it will matter. Also, you have to be sensitive of the networks because some carriers have a network that could be this big or this big. You can't necessarily say they have a national network because there could be areas of the country they just aren't contracted with doctors and hospitals in that area. So If you're traveling, it's always good to call them and just let them know where you're going to be. City, zip code is usually what the customer service rep needs to look stuff up for you. And a lot of these plans can have a $0 premium. And most of the plans, if you're taking prescriptions, will include prescription drug coverage in that $0 premium. You don't need a separate plan for that. And the reason I'm pointing this out is if you choose a Medicare supplement plan, Medicare supplement plans are a national network. All they say is if the hospital, lab, doctor, whatever they call themselves professionally, take Medicare A and B, they will take your supplement plan anywhere in the country. Medicare supplement plans are also going to be referred to as Medigap plans. That is because they are picking up the 20% not covered by original Medicare. So if you do a supplement plan, Medicare pays its 80% first, that 20% is then picked up by your insurance company. So again, with private insurance companies. Now these plans will have a monthly premium, and in a couple of pages I'll go over the benefits of a Medigap so you can kind of see why there's a higher premium for those. Medigap plans do not include dental, vision, and prescription drug coverage. So you would have a separate prescription drug plan with a private insurance company. It can be with the same company your Medicare supplement is with. It can be a different company, it's totally fine. This is why knowing prescription information is helpful in narrowing down costs to you for the next year. So those are kind of the four basic parts of original Medicare, even though some of them are actually with private insurance companies. I'm going to switch to page 2 now. This is the graphic with the donut hole on it. So bear with me, this can get a little confusing. I will make it as simple as I can. Even though your prescription drug coverage, whether it's with an Advantage plan or a standalone prescription drug plan, all of the insurance companies have to follow this framework set up by Medicare. So there are 4 stages to drug coverage. So the first stage, or phase 1, is the deductible. Not every plan has a deductible on it, and they're set by private insurance companies, so it could be a $0 deductible or anywhere between the $0 and the $445 max for this year. That is going up in 2022 to $480. The deductible applies to any prescriptions that are called tiers 3, 4, or 5. These are brand name drugs, drugs you see commercials for, or drugs that just aren't widely prescribed. So when you take one, when you go to get it refilled, if it falls into one of those categories, you'll be subject to the full cost of that drug up to your plan's deductible. You only pay the deductible once. You don't pay it per prescription and over and over and over. So if you're taking a prescription that is kind of pricey, you hit that deductible, you go into phase 2, which is called the initial coverage level. So what happens here is your insurance company is now picking up generally 80% or more of the cost of your prescription. You're going to pay the remaining percentage, the cost of that. And it'll remain that cost as you're going throughout the year. But what is happening in the background, they are keeping a running total of the full cost or the full retail price of your prescription month to month to month. And they're keeping a running total of that because if you notice at the bottom of the phase 2 there's a limit. And this year it's $4,130. It's called an out-of-pocket expense maximum. Once the full cost, including you paid your deductible, what you've paid, and what the insurance company has paid, hits that number, you are now in the donut hole or the coverage gap. So once you get into the coverage gap, what happens is you are now paying 25% of the cost of your prescriptions, both generic and brand name. So you'll stay in the coverage gap, and depending on when you get into it, you may or may not get out of it, because like I said, Medicare runs January 1 through December 31st, so it's calendar year. But you don't start back over at zero once you get into the donut hole. Whatever amount you got you in there, which is going to be basically around that 4130 for this year. Next year, that is going to go up a little bit. But if you happen to get out of the donut hole because of the cost of your prescriptions, you move into the last stage, which they call catastrophic coverage. Catastrophic coverage means you're generally going to pay $3 and some cents for your generic, $9 and some cents for your brand name drugs, or you're going to pay 5% of the full cost of your prescription. The takeaway from this is there's really no point at which you stop paying for prescriptions throughout the year, because Medicare does not cover prescriptions. So, give you an example. Say you're on a prescription that retails for $500. The first month you take it, it's a tier 3, 4, or 5, you pay your deductible. After you pay your deductible and you refill it the next month, you may only have to pay like $47 for it, and that's because you've paid your deductible. Now the insurance company is picking up their portion of the cost of your prescription. You're going to pay that $47 all along. Then, kind of towards the end of the year, you might all of a sudden go, oh, the price of my drug went to $125. You're in the donut hole. So you're now paying 25% of that $500. So your drug cost, depending on what you're taking, can fluctuate throughout the year. It's perfectly normal. On the other hand, if you're on a widely prescribed generic, which a lot of people are, your cost could be a couple of dollars to fill your prescription. It's probably going to stay that level throughout the rest of the year, and you won't go through all these stages. So you just, as a reminder, share your prescription information, because agents are not allowed to directly ask you what you're taking, even though it helps pick your plan. So just, you're going to need to share that information. I would say have it ready. If you forget something, you can always call somebody. So I know the donut hole coverage gap can be clear as mud. It will make more sense when you have some stuff in front of you that pertains to your prescriptions and stuff like that. So with that, I don't know if there's any questions coming in that I need to address. Okay.
Encourage them to ask some questions.
Okay. So there is a chat box. So if you have some questions in there, please feel free to put that in there. And if it's not a specific carrier plan, I can answer them. Because of Medicare rules, I just have to kind of keep this educational. Page 3, I include this page in here because there's 2 columns in there. And honestly, it should say original Medicare or a Medicare Advantage plan. So when you first sign up for Part B, which is either going to be when you first turn 65, or if you delayed Part B because you're on your employer's plan and they have creditable coverage, this starts your enrollment period. So when you first sign up for Part B, they do not ask you any medical questions. You're guaranteed issue, you're in. However, say you're a couple years down the road and you want to look at changing options. Here's what happens. If you originally signed up for a Medigap plan and you want to move to a Medicare Advantage plan, you can do that. They don't ask any medical questions. If you want to move from a Medicare supplement plan from the carrier you first enrolled in to a different insurance carrier, they will ask you medical questions. You will either be accepted and possibly charged a higher rate, or they will decline you based on your medical history. The same is true if you start originally with a Medicare Advantage plan and want to move to a Medicare supplement plan. You will answer medical questions. Same rules apply. They may or may not accept you based on your medical history. It's always worth asking. I talk about it every year. when you first sign up for Part B of Medicare, you kind of have a couple of time periods to enroll. So when you first are turning 65, you have the 3 months before, the month of, and 3 months after. That's called your initial enrollment period or initial coverage election period. Perfectly fine. Some people choose to delay signing up for Part B because they want to stay on their employer's plan. They're delaying retirement. Maybe they don't want to retire until they can get their full Social Security benefits. All of that is fine. You can do that. You just need to double check with your employer, HR department, or whoever's handling the benefits at your company to make sure the plan is called creditable coverage. Your employer sends out a notice every year, about this time actually, which is currently in October. If your plan is creditable coverage, you can delay all of that. What creditable coverage essentially means is your current coverage is as good as, if not better than what Medicare covers for prescriptions. So if that's fine, you can delay all this, you stay on your employer's plan, and you don't have any penalties later. So it's a little confusing. So ask questions. Again, in the chat box there, I can review anything you need. The other thing that's going on is there's always a Medicare annual election period. It happens October 15th through December 7th every year. This is when you're going to review your Medicare Advantage plan and your prescription drugs because there's going to be changes from year to year. It's always good to review that. You may stay with your current plan, you may want to move. So just keep that in mind. That's the main period when everybody does their review. I'm going to move on to page 4 now, unless there are any questions. Okay, so page 4 is a grid of all of the current Medicare Supplement or Medigap plans that are currently available. I have one caveat. If you turn 65 after January 1 of 2020, plans C as in Charlie and F as in Franklin are no longer available to you. The federal government is no longer offering 100% coverage plans. But if you turn 65 before January 1 and say maybe you delayed enrolling because you're on your employer's plan, you are still eligible for these benefits, okay? For C and F. This grid right here, these are how all of the plans cover medical care. It does not matter which insurance company you go with. These are national networks. So if you go with company A or company Z, and let's say you choose a plan F as in Franklin, everything's covered at 100% except for foreign travel. Or if you choose a plan G, everything is covered at 100% except for there's a Part B deductible. The Part B deductible in 2021 was $203. In 2022, it's going to $217. But that's the same benefit across all of the plan Gs. So it's just a matter of doing some research on the monthly premium, asking questions about optional benefits, because they're all a little different. They're private insurance companies. So I would say always look at both options depending on how you want to do your retirement, if traveling, not traveling. Look at an Advantage plan, look at a Medicare supplement plan, and working with an agent help keep your budget and everything in mind. So, and just know you can review it every year during that open or annual election period. So you're not always stuck with the same plan necessarily. There are a couple other options on here. They're a little bit different. I don't want to go too far and make it overly confusing for everyone because I already know you're getting bombarded with tons of mail and tons of phone calls. So there's no way to turn off the mail. We're all going to get tons and tons of mail advertising it. The other thing I'd like to point out is you will start getting phone calls. In the state of Ohio, agents like myself are prohibited from calling you, going door to door, approaching you. Like if I don't know you, I'm not allowed to contact you. That is actually illegal. So what's happening is those phone calls, even though they have maybe a local area code exchange, are probably somebody outside of the state or even outside of the country, and they're just going to automatically transfer you. To who, I'm not really quite sure. So just be a little leery of those. I would say find an agent that you are comfortable with working with, and work directly with them, because the phone calls, they're nonstop, and they happen every year all the time. With that, are there any questions or anything coming through?
What's the difference between Medicare and Medicaid?
Okay, so that's a great
question.
I was going to say, that's a great question. The question was, what's the difference between Medicare and Medicaid? Medicare is health insurance mainly for people who are 65 and older. You can get it sooner if you're on Social Security disability. You have to be on that for 24 months. Medicaid is based more on your financial, like your annual household income. They can work together, especially on Medicare Advantage plans. And depending on where your income level falls, you can actually sometimes qualify for extra help to cover costs. But again, that's on Advantage plans. So Medicare, think care, which is health insurance, and Medicaid, think financial aid. That makes it simple. We get this question all the time, so that's a great question.
Is Medicare mandatory?
Is Medicare mandatory? Wow, I've never had anybody ask me that. It's not mandatory, it just kind of happens on autopilot. Like when you turn 65, you get the Part A automatically. Everybody does. Because you've been paying into it. Now there are certain professions, if they don't pay into Social Security, it's a little different. But for a vast majority of the public, it's not mandatory. But if you sign up for A and you don't sign up for B or anything else, like you're leaving yourself exposed to a lot of health insurance claims, like if you have an emergency surgery or something like that. So I guess it's just prudent to maybe look at it. But no, it is not mandatory. Any others? So I want to thank everybody for taking the time to watch this today, and anybody who may review it later. If you have additional questions, I'm going to share some information with you on how to contact TrueCore. So the first one is the email address. It's info@truecore.org. You can call or text 740-345-6608. You can also go to the website www.truecore.org. I would just say maybe reference the Medicare 101 educational video that you watched, and they can put you in touch with my information. And just remember, you have to reach out to me first. Again, my name is Bud Fassnacht. I'm with Creekstone Benefits. I also want to point out I'm only licensed in Ohio. I don't know how far reaching this is, so I just want to point that out. I'm not licensed in other states, which is an insurance thing. So thanks again, everyone, for attending. I appreciate it. And thanks, TrueCore, for allowing me to share my knowledge.